Hello, today our topic of discussion is sepsis and septic shock. Sepsis, old definition is body extreme response to an infection, and new definition is life threatening organ dysfunction due to dysregulatory host response to an infections. And another septic shock, new definition is a subset of sepsis leading to circulatory, cellular, metabolic abnormalities which are profound enough to cause increased mortality. And sepsis, another new definition is sepsis induced hypotension which is persists despite adequate fluid resuscitation if mean arterial pressure is less than 65 and lactate is greater than 4 and require vasopressor. Old stages of sepsis are SIRS, sepsis, severe sepsis and septic shock. New stages are sepsis and septic shock. And infection that lead to sepsis start in lungs, urinary tract, skin and GIT. And then we see that what is SIRS. SIRS is systemic inflammatory response syndrome, which is widespread infections that lead to hormonal, tissue and vascular changes. In sepsis, hypotension occur, decreased urinary output occur, and respiratory rate occur, decreased cardiac output, and inappropriate clotting. SIRS criteria are increase, which are then discussed. It is increased respiratory rate greater than 20, which is tachypnea, and increased temperature, hyperthermia or hypothermia. If it is greater than 38 centigrade is hyperthermia, and if greater less than 36 centigrade is hypothermia. Increased spirit rate, temperature and tachycardia is rate is greater than 90 per minute. These are signs of SIRS. In sepsis, cytokine release, which is increased capillary leak, decreased anti-clotting activities, smart clot formation that lead to DIC. Then we see how DIC is associated with sepsis. In sepsis, vascular endothelium is injured. Vascular endothelium, at normal vascular endothelium, protein C presence which prevent the clot formation. In sepsis, vascular endothelium injure and decrease blood level of protein C that lead to small clot formation and DIC occur. Then we see in septic shock, this CNS on CNS, this if CNS system is affect, then confusion, lethargy and coma occur. And pulmonary changes are arterial hypoxemia, partial pressure of oxygen FiO2 less than 300, cardiovascular disease is hyperlactemia, which is greater than 1 millimole per liter, and decreased capillary refill time. And this table is most important. You see, is in and first we tell you glucose. In sepsis, glucose is released from liver and that will lead to hyperglycemia. And then we see in early sepsis, severe sepsis and septic shock, what changes occur in cardiovascular system, respiratory system and skin and kidney. In early sepsis, cardiovascular change is decreased cardiac output, decreased BP, and respiratory change is increased respiratory rate and skin warm without cyanosis and decreased urinary output. Severe sepsis, their compensated mechanism occur. They increase cardiac output, then increase heart rate, increase BP, and increase depth of respiration, and skin is cold, calm, and associated with cyanosis. In septic shock, decreased cardiac output, decreased BP, and ARDS occur. Acute respiratory distress syndrome. and skin changes are cold, calm, cyanosis, and tachy and ecchymosis are associated. If you are any question related to this video, please ask me in comment section. Kindly like and share and subscribe my channel. Thank you. Allah Hafiz.